What's up, everybody? Welcome to NWA Nurses with Attitude. Leanne and I want to throw a quick shout out to the listeners. Thanks for tuning in. We appreciate your support episode after episode, and we hope you guys enjoy this content as much as we love making it. If you guys want, go check us out on our social, Nurses with Attitude on Instagram. That's where you'll find all the updates you need, and also shoot us a message if you want. Enjoy the episode, guys.
Hey man, happy Love Day.
Hey, happy Love Day.
For anyone listening, we're recording this on Valentine's.
Love Nurses with Attitude. So we thought it would be a great day to record.
You know, honestly, Joe, I've never been someone who takes part in like Valentine's Day. Like I just couldn't care less, to be honest.
I used to be like a Mr. Celia girl, man. Like back when I was younger. Like, man, on Valentine's Day, like no one was safe. Like, man, I was very, very romantic. I was like,
No one
dude,
was safe.
I would bake, I would get like everything, I would do arts and crafts. Every other day of the year, I'm completely useless.
Yo.
But you know, like it wasn't in a sense of like you know, trying to I saw an opportunity to show people that they're loved and they're cherished, and I would just give gifts to everyone, man. I love that. I thought it was so fun.
That's so funny. I actually like on a day like today, I enjoy scrolling through Facebook because you see all of the like, remember when we were kids and we were in school and we would give little Valentine like cards to our classmates and stuff? Well, everybody's posting these for their kids and they're so stinking cute. Like it just makes me smile. But for myself, like I just couldn't care less. Like, I don't know. Like to me, it's kind of like a Hallmark holiday. But
Yeah.
anyway, love the nostalgia of the
sure
day.
is. Honestly. So I guess you and Ben, do you guys have any plans tonight? Well, I guess not, because you literally messaged me like an hour ago. You're like, oh yeah, it's Valentine's Day.
I'm like, yo, you want to record? And then I'm like, oh wait, it's Valentine's Day. Like he's probably doing something with his wife. So to answer your question, no, like no plans. We're just chilling, having a night to ourselves. Gonna have dinner together. You know, regular night at the Lind Inn. That's what we like to call our house.
The Lind Inn. Damn.
Yeah.
I like that. That's pretty catchy. That's good.
Yeah. So.
Yeah, we're not doing a thing either. Like I was actually debating on going to the gym, and then I was like, you know what? Maybe I skip the gym tonight to spend it with Jelena.
Yeah.
But we're just gonna do the same thing we we do every other night. Watch Smallville and eat some snacks.
Yeah, exactly. Same with us. Same shit, different day.
Exactly.
Yeah.
Yeah. So today's topic, I had watched this movie and I forget what it was called, but it was with Denzel Washington. And it's pretty much this father holding the hospital, holding hostages in the hospital to get his son a heart transplant. So essentially his kid went into heart failure.
Okay.
And they were holding him at the hospital, and they were like, well, he needs a heart transplant or he's not going to survive. And they're like, okay, well, put us on the list. And they're like, well, it's a $250,000 procedure, and we need $75,000 just to put him on the list as like a down deposit. And they didn't have that money. And he thought he had insurance, but then the insurance company like screwed him over, and they're like, no, we're not covering this and all that. Mm-hmm. So they wouldn't put his kid, like this 8-year-old boy, on the heart transplant list. And he ended up holding the people in the hospital hostage, being like, get my kid a heart transplant or I'm going to start killing people. Yeah. And I just started thinking, and I was like, that is a reality for so many people in the United States. And I hear stories of, you know, like you're not covered and you're pregnant and you give birth and you go into some serious debt, like hundreds of thousands of dollars in the States if you don't have insurance.
Yeah, man, I've seen like, and I don't know how real these are, but like online, you scrolling through Instagram, you see this random video of like they're going through their hospital bills and it's like $30,000 because I gave birth. The meals were $400 a night while I was giving birth. Wow. Like, I don't think we realize like how good we have it here in Canada. Now, that's not to say that like Canada doesn't have its own issues, because it definitely does. But yeah, you're so right, especially in that movie. Like, I think I've seen this movie, but I haven't watched it recently. But you know, obviously they're trying to to show that, this dad would do anything to save his child, really,
Mm-hmm.
And so like his total ethics go out the window to save his kid. And like, I just think that that's, I mean, obviously it's not okay to kill people and like hold people hostage. I just want to make that clear. But the act of him doing, like, totally putting aside his own ethics and values and all of this just to save his kid is like pretty awesome. You know what I mean?
Yeah.
Like,
And like, would you not do that? And at the end of the movie, it turns out the gun
yeah,
he had wasn't loaded at all, and he was like a
yeah,
really, really like good guy.
yeah,
But I think what was crazy too is how these people. I get it, it's a business, but how you could look at this family and not at least just say like, we're gonna throw his name on the list and then we're gonna work something out. Like we're gonna work something out, and
yeah.
we're gonna figure out like what we can do. Um, at the end of the day. But yeah,
Or
to put those, it's just crazy that they're even in that situation. Where in Canada now, a lot of this topic that I was thinking about today too was kind of trying to discuss the possible benefits of privatization in some way, just because we
mm-hmm.
do know the system right now. It's shot like we're not doing too good. It's not going too
Yeah.
hot for us right now in Canada.
Mm-hmm.
But on even saying that, we're blessed that we can get hip surgery in covered. Knee surgery in most provinces are covered.
Yeah.
Pregnancy, like I don't think we have to pay anything
No,
when you give birth in a hospital.
I don't think so, unless you need to stay for an extended amount of time. Like, I think you'd have to pay for your room, or if you wanted a private room, I think you can pay to like upgrade. But for the most part, I don't think so. Like, out of all my friends that have kids, I've never really heard of anybody saying like they got a bill in the mail,
Yeah,
unless they're, like I say, they had to stay or wanted a special room, or requested something additional. You know what I mean? Um,
but just like add-ons, like the
yeah,
core like care and stuff, and like I heard this from a nurse that in the States, whenever you go to get supplies, so like let's say if you're using like a little med cup to dispense medication, or like you're getting them a box of Kleenex, they actually have like a scanner and you charge them. Like they have to like ring a barcode
whoa,
for like every little thing that you like
that's
get them.
that's excessive.
That's what I thought too. But and so for most of you don't know, the way that our um health system works is that we have universal health care that's funded through taxes. So the taxes that we pay essentially should be going into our healthcare system. And this is why we have universal healthcare. And it pretty much covers almost anything except for procedures that are
Like elective.
not like elective.
Mm-hmm.
And even with that, there's a lot of controversy between like what's an elective surgery. So, for example,
Yeah.
if you get burned and scalded in a house fire that was completely accidental, if you want to get skin grafting done, that's elective. I disagree with that. I'll be straight up. I disagree with that. I don't think that's right. Um,
Yeah.
but that's kind of an example of it. And we all have these little cards, and they're provincial cards, and they give us access to this healthcare system um, that we essentially pay into year round
Yeah.
whenever we pay taxes. And
Mm-hmm.
I think we learned this in nursing schools that
Excuse me.
healthcare is available to everyone, and everyone has the right to access healthcare. That doesn't mean that you'll get timely healthcare, though. That
This
doesn't
is the
mean like
thing.
you'll get it when you need it.
Right.
If
This
that
is the
makes
thing,
sense.
Joe. It's like, we do have publicly funded healthcare, but there's also a private side as well. So the thing with the public that, Joe's saying is that, fine and dandy, we can go get blood work anytime we want, but we still have wait lists here for knee surgery. We still have wait lists here for these types of things. And so a lot of people will opt for the private route, pay out of pocket, and then get whatever they need done, or whatever the case is, quicker.
Yeah.
So like there's two sort of streams here in I guess Canada, but more specifically Alberta is what I speak for. But yeah, Joe, I technically work in the privatized side of healthcare, and you work in the
Mm-hmm.
public side, which is pretty
Yeah.
interesting.
It is very interesting, and I think
Mm-hmm.
a cool like topic that kind of goes down is and I'm not sure if you can speak on this because it can be kind of controversial, but you start getting different classes in Canada. You get the people who can only access the publicly funded, um,
Yeah, for
and then
sure.
people who can get like the privatized. Because so there, it's kind of this whole um, it's very popular right now in media. Um, with all the politicians being like, we can't privatize medicine and all this and all that. People don't realize this. There is a lot of privatization already in Canada. We
Yeah,
just suck at utilizing it.
yeah.
Like all the clinics where you get X-rays done, most of those are actually privatized clinics that are just sourced out. Um,
Well, a lot of people will have their insurance reimbursed too. So, um,
yeah,
but like you say, like there's definitely classes where, you definitely see a certain demographic of people who can afford the private side versus the person that'll sit and emerge for 16 hours plus because they can't afford to go get this special x-ray done or whatever, like there's definitely a divide for sure.
oh, big time. Um, and the question is, would privatization be helpful in Canada? And that's a tricky question because, um, first of all, who knows, right? And I think it's difficult because each province is funded. Like
Yeah.
like healthcare is provincial in Canada, so it's so different. But I know, for example, Alberta is a lot
Mhm.
more privatized than Ontario is
Yeah.
because during COVID testing, in Ottawa, it was the Ottawa hospitals and the publicly funded healthcare system that was doing all the COVID testings. But in Alberta, it was the privatized section that was doing all of the COVID testing. Um,
Yeah.
and in terms of actual healthcare, I think that there were still issues in Alberta and Saskatchewan right now. There's a huge lag in like hip surgeries. People are waiting um, years, like years, to get hip surgery,
Yeah. Same
and
here.
it's crazy. And I think people are actually getting sent from Saskatchewan to Alberta. And the thing with that is, you can go to the States and they can get you in probably the same week or like a couple weeks. But it costs like I think 33,000 per hip. So if you're getting a double hip replacement, it's about
That's insane.
63. Then you add costs of like travel and everything. It's like good like 70, $80,000.
The thing is, Joe is like, we talk about like the price of something, and it's just like, I can't even fathom because I was honestly brought up to have free healthcare. It's like, oh, I need blood work done every 6 weeks. Cool. I'll just go get my blood work done. No problem. It's like an
Yeah.
hour out of my day. No problem. But in the States, like when you really look at the difference even between Canada and the US, I don't even know what Europe is like, but they pay to get blood work done. And it's just like we're so fortunate, really. Like we're very lucky to be able to have that. And so these people who can't afford, like you see people in the States who, I'm using the States as an example, but people can't afford to maybe go get blood work done. And then
Hmm.
what is that? How does that reflect the nation's health status?
Yeah.
Like there has to be some comparison between the private healthcare in Canada, let's just say, versus the privatized healthcare in the US. Like what are the health status differences between people? And I know that obviously income and economic class, like money plays a huge role in anything in life.
Yeah.
I'd
That's
be
very
so
interesting.
interested to like have us like see a study on that, or I don't know, I haven't like done any research on this episode. We're just kind of like shooting the shit, but
Yeah.
yeah, that would be really interesting to see because I know that there is talk about Alberta moving to a more privatized model, but like I don't
I have
know.
a
The thing
question for
is,
you, Leanne. I have a
yeah,
question. how often do you, and I know that you do have an underlying like illness that you spoke about before, but how often do you go to the doctors to just get like a physical done?
Once a year is like my
Once a year.
required. Yeah.
Same here. How often do you
Yeah.
go to the dentist
Every
to get
6 months.
every 6 months?
Yeah, but only
Okay.
because, Joe, my insurance covers every 6 months, but they recommend every 4 months. And I'm like, no, no, no. I'm
No,
not
I
paying
think
for
6 months
this.
is pretty good. Yeah, yeah.
So when I didn't have coverage, like when we were in school, I didn't go to the dentist. Like, are you kidding me?
And that's what I was gonna say, because like right now, like I go to the dentist every 6 months. So I actually have a dentist appointment tomorrow. Um,
I have one
but
next week.
right, like look at
Yeah.
us, look at us,
Yeah.
look at us. But the thing is, doctor's appointments for most Canadians, I assume it's like, hey, like let's go get checked. We're healthy, just see if anything's wrong.
Mhm.
With like teeth, for example, and this is the only way I can compare it to the States, is I only really like I used to only go to the dentist when I had a lot of pain. And it's
Yeah.
like for the first like 25 years of my life, like
Yeah.
that's how I dealt with dentists, because dentists are expensive for dentists. If you don't have insurance, you're screwed. You got to pay the whole price, and it sucks. So now that I still don't have insurance, but I have more income that I can go for cleanings every 6 months, get checkups, make sure everything's fine in my mouth. But I
Yeah.
think it's kind of the same in the States, and that does propose a huge question of would their health, and I don't know, can they get physicals every year without paying anything, or like is the cost very minimal? I wonder
I
like if it's like
I
only
don't
like
know.
$50.
I don't know what the cost would be, but I mean, you still have the option to have insurance in the States. You just have to pay into it
True. And I,
like
I
we do
assume a
here,
lot of people
technically.
have insurance. I assume a lot of people in the States. They
Yeah.
have
I
to. They
mean,
have to have insurance.
yeah, because like how else can you afford any type of healthcare? I mean, Joe, you talk about how dentistry here in Canada is not covered. Well, so what? Oral hygiene is not a top priority for our health? Of course it is. It's like number 3 on the list. Like after diet, exercise, oral hygiene. Like, are you kidding me?
Right? Oh, it's huge. Well,
Like,
like, I've actually had some issues with my teeth for a while, and it's because, like I said, I straight up just didn't go to the dentist for like 25 years of my life, only when there was like really, really bad pain.
yeah,
And I have this one tooth that's really bugging me, and the issue's all fixed now. But I couldn't eat certain, like I wasn't eating any protein at all, Leanne, because any meats, it would really really bug that tooth, and it just made me think that's a huge factor that could affect someone's health if they have poor dental hygiene.
yeah,
And that is part of your health and wellness, because if you can't eat foods and nourish your body, or like let's say if you have like a TMJ, a jaw issue, and you can't open your mouth, and it's very very painful, that's even more expensive, because you need to see a specialist at that point, and you can't open your mouth, so you can't eat certain foods.
I've heard
um
that they're using Botox injections for TMJ issues
yeah,
where the muscle gets so tight that the Botox actually releases that muscle. And so,
yeah,
but universally, Botox is very much a cosmetic thing. But in the sense of like you say, being able to eat properly, Botox should be covered for that use. Why
yeah.
should it not?
Well,
It's a treatment
Jelena
just like anything else.
Jelena gets Botox, and she has to pay out of pocket because Jelena has some jaw issues.
Yeah.
And that Botox, Leanne, it has crazy increased her quality of life in dealing with
Yeah.
her TMJ. Like it's wonderful. It's
Yeah.
not covered anywhere. Actually,
I
I think it was covered in Alberta, but when we moved to Saskatchewan, it wasn't covered. And right there is a difference in
right.
provinces.
Right. And I don't know what the cost of Botox is. I think it's like $10 a unit, but you end up getting what, like 100 units or something. Like it's expensive. It's not cheap.
But then you have to pay for them actually administering it, because they have to,
Right.
like, you have to go to the dentist, and it's not super expensive. I honestly can't even like remember, but she gets it every 3 months.
Yeah.
Um, and you have to like keep it like frozen in the fridge, and but yeah, like that's a great use for Botox that um arguably so should be part of the universal healthcare.
But I
Um,
think, Joe, it's like any situation, like the problem is like you talk about that burn victim. I agree with you that should be covered, but at what point do we draw the line? How do you establish what's covered and what's not? Like, what determines one scenario significant versus another scenario that's not significant? Like,
yeah,
do you see what I'm trying to say here? Like, I understand there has to
subjectivity.
be some baseline, like what's covered, what's not. I get that. But like
Yeah.
oral health, oral hygiene should be covered.
Well,
Your
because that should
cleaning
be
should be
part of
covered.
our, yeah, that should be part of our health. Like if we say we have universal health care, but we're not covered for like dental work, but then you can argue dental is part of healthcare, and that's quite a like that's an objective fact almost that
Yeah.
our mouth is part of our body, and it's thus should be included in the abstract concept of health.
Yeah.
Um, and yeah, I think subjectivity plays a role, and I think that's why a lot of people are pissed whenever it comes down to a lot of decisions that are being made, because they're made. And I'm not getting into politics here, but some politicians can make decisions. Okay, well, knee surgery isn't that important, but that decision is being made by someone who doesn't have knee issues. If they had knee issues, I'm
Right.
positive they would have a different view of it.
Right. Because it would affect their quality of life.
It would affect their quality of life. Like I can
Yeah.
sit here and say all day, like hip surgeries shouldn't be covered. Like, come on, like just pay for them and do your stretches. Like maintain healthy hips. But then you have some people who are born with like deformed hips, or they just get in accidents, and
Yeah.
tell them that their quality of life, you know, isn't affected by having a bum pair of hips. I think
Yeah.
what I'm trying to say is that we kind of need to do a better job at objectivity and understanding everyone's points of view while making these decisions, instead of just having the decisions made by a select few group of people, you know?
Yeah. I definitely think the thing is, though, Joe, is like if they give in some area, they have to take from another area. You know what I mean? So it's just like, how do they really please everybody? They're not going to ever.
Yeah.
But one thing I want to share is because I see the divide between privatized and publicly funded healthcare every day. Like every day I'm out in the community, it happened today. And I met with a client and we were talking about starting services. And she mentioned to me, she said, we've had really awful service in the past from Alberta's home care, like our provincial publicly funded home care program. And this is not the first time I hear this. And the thing is, Joe, is these people who, their moms and dads or uncles or whoever that they're advocating for require care and they feel their needs are not being met. So they're forced to go to the privatized side and pay out of pocket. Now, a lot of it's covered by insurance and whatever. There's a lot that goes on behind the scene, but I just think it's important to mention that, like, in my job, day to day, I see this and the complaints of the publicly funded, like the poor service, you don't get a say in what caregiver you get. You don't
Yeah.
get a say in the hours you're approved for. And, like they may approve someone who has Parkinson's, let's just say, for like 3 hours a day. Okay, well, they need help with AM and PM care. So 3 hours a day is not enough.
Mm-hmm.
Like
Mm-hmm.
anyone who's not an idiot knows that. Like, come
Yeah,
on.
of course.
And it's just the divide is it's sad because these people are advocating and they're trying to do what's best for mom or dad,
Mm-hmm.
but the system doesn't allow the best care. It allows for some care, mediocre
Yeah.
care, but it doesn't allow for the best possible care.
Mm-hmm. And like that 3 hours that you mentioned, that would essentially be like 1.5 and 1.5 in the AM and then in the PM. But we all know if just elderly people in general, but then you have someone who has Parkinson's disease or even MS or
Yeah.
ALS, or muscular dystrophy, um, 1.5 hours in the morning might not be enough time to do everything. Like we
No.
need to realize that people who are living with disability or disease, they need a lot more time to get ready in the morning, to eat their
Yeah.
food, to do something that might take me 15 minutes to get ready, eat a quick breakfast, and then like run out the door. Um, Come back when I'm 85. Like I'll tell you right now, it's not going to take me 15 minutes to do all that.
Right. Yeah,
Um,
exactly.
and that's, I think that goes back to that subjectivity. Like they'll go 3 hours is enough, but you're saying that's not enough.
I just don't understand, like, the case manager that works for the government that is like, yeah, 3 hours is good. How can you say that? How can you be like, yeah, we've approved you for 3 hours?
Mm-hmm.
Like, I,
Well, I will be
I don't know.
the devil's advocate. I'll be the devil's advocate and
Yeah,
say I like to see the best in people, and I think that they're sitting there and they like you said, it's kind of almost common sense. Like they should be seen like, yeah, this is unfair, and it's they also we have a lot of Canadians. There's a lot of people who need care, and we don't have enough healthcare providers, and we don't have a good
yeah,
enough system to be able to allocate, healthcare in the way that we really want to. So
yeah,
I could just assume that like that's a very difficult job to be tied into, right? Like it's like you got 10 apples and you got to feed 100 people. Like what are you gonna do, right?
yeah. And well, that's sort of what I'm getting at. It's just like, how does that nurse ethically not struggle internally with being like, oh, well, your
Mm-hmm.
dad is a paraplegic. Well, he only gets an hour of care a day. Well, like, that's not enough, but that's all they can offer. But it's not good enough.
Mm-hmm.
You see what I'm
They're still
getting at? Like,
struggling. Oh, 100%.
yeah.
Yeah, they're still
But
struggling. Like
yeah, but like you say, there's 10 apples and 100, like 100 people just that need help, and you like, what are you supposed to do? We're all pulling from the same pot, and staff will go where the money is and the hours, and that's sort of how it is. And
yeah,
it's a dog eat dog world, man. Like, I will
dog
set
eat
up,
dog.
I will set up staff with clients. They'll have like a couple shifts a week, whatever. They're like, yeah, yeah, yeah. The day comes and they're like, oh, sorry, I found another job. And I'm like,
Oh,
okay, now what do I do? Like,
yeah,
whoa. It's just,
and that's tough.
yeah, it's tough, man.
That is tough, and
Yeah.
people like we all have our own lives, and I'll always advocate for people if you make a decision, because you think that like it's gonna benefit you, then do it. And it's so hard whenever those decisions do affect other people,
Yeah,
and
it is.
and they end up because like you're a team. Everywhere that I've been, um, I think I've always done a pretty good job of giving like a good notice. I if I can, like I've given 2 week notices, but if I
Mm-hmm.
can, I like to give a month or so. You know what I mean? Like just a
Yeah.
while. But like it's tough because sometimes things happen and you just can't, right? And you're like, well, I need to like go on and
Right. The thing is like, I wish people would just communicate. Like, if you're leaving for more pay, like, let's sit down and talk. Like, let's negotiate. There's,
finesse. Oh
yeah,
yeah.
like, I just feel like there's not a lot of like open conversation around employment. And it's just like, if you're not happy, tell me. Like, what can I do as your case manager? Tell me what I can do. Do you want more hours? I'll find you more hours. You know,
I think
like,
a lot of
are,
people got very like I feel like, and I don't want to change the subject, but I think that kind of goes into like our society. We don't like advocating for ourselves. Like if you're given something,
no.
people will just look until someone offers you something a little more. But I've always been
Yeah.
like the kind of person like f- finesse yourself. Like this is who I am. These are my skills. These are my abilities. This person's
Yeah.
giving me this much. How much are you gonna give me?
Yeah.
Like work it, sell yourself, people.
Yeah.
Like you gotta sell yourself. You got
What's
like
funny, Joe, though, is that on the other hand, I'll get like a healthcare aid that will apply, and they're like, I want $32 an hour. And I'm
oh,
like,
okay.
absolutely not. Like, no.
I
So
want full
there's,
benefits, $32 an hour,
right. And
a
it's just kind of
Benz.
like, come on, man, like,
Yeah.
within reason. Like, there's yeah, sell yourself. You have skills, you have talents, you have training, you have all these things in your pocket. Like, leverage that, but just know that there's also like a capping point as well. Like, I can't just like pull money out of the air. You know what I mean? Like, and
Oh yeah.
but ultimately, Joe, like, people will go where the money is because they need to afford life. And so as things become more expensive, like, this is for any job. I'm not just speaking about healthcare, but like, if I was a manager at McDonald's, like, I might go move to Arby's because they pay $3 more an hour. You know what I mean? Like,
Oh man. Arby's got
that's
that good pay.
yo, we got Arby's here. Do you in Saskatchewan?
We do. I think we only have like two in Saskatoon.
Yeah, yeah,
But man, they have this really cool thing that like we went inside one day. We're like, let's go inside, just pick up our
yeah.
food. We were going to take out, and they have this huge bell that you can ring if you're satisfied with the
No.
service. And I was
Oh
ringing that
my.
motherfucker.
Of course you did.
I was like, "There's a bell," and they're like, "Yeah, if you're satisfied, you can ring it." I'm like, "Fucking step aside."
You're like, hell yeah, let me through.
Man, I rang one of those bells once at this bar, and I didn't know that means that you're gonna buy everyone around. And I just saw a
Oh.
bell. I just started ringing that thing because when
And
I see
everybody
bells,
started cheering.
everyone started cheering. So I kept ringing.
Yeah.
I was like, "Yeah!" I was just going. I was like ringing it, ringing it, and
Oh
yeah,
my
I
god.
got the memo. I was like, "Oh."
You're like, oh shit, never mind. Bail hard.
I bought everyone a drink. I had to.
Oh my god. How much was that?
It was at a wedding, and it was toonie, so it was like
Oh, that's not
I
bad.
don't even remember. I think I just threw some money at them.
Yeah.
It was at a wedding, so we were partying. But it wasn't that
Oh
bad.
man. Oh
Yeah.
man.
But anyways,
Totally off topic.
back on topic. Another thing I want to touch on is medication. There's some people who need medication to function.
Yo, don't even get
It's a
me riled up.
non-negotiable,
Don't get me
and
started.
medication is not covered. Leanne, I know you must have experience with this. Like, are your medications covered, or do you have to pay out of pocket, or
No, they're not covered. Like, I have benefits, sure, that's fine. I'm not worried about me, mine is pennies. I'm not worried about mine. My thing is insulin. Why the heck is insulin not covered? Why are
insulin's expensive, by the way.
why are blood sugar glucometers not covered? Why are the finger pricks not covered? This shit is required. Like, I don't know how angry I have to get about this before someone to fucking change it.
We're gonna
It's
post
just
this clip.
like,
We're gonna post this clip, and
yo,
we're
I'm
gonna tag all the
feisty.
politicians.
It
Well, it's
makes me
true.
mad. It's true. They need that to live. To live. Their liver cannot function without it. You
Hmm.
know?
Yeah.
Ugh.
Like you. So for those of you who
Ugh.
don't know, if especially if you have type 1 diabetes, you need insulin. Like type 1 diabetes
Mhm.
is there is a genetic abnormality with your pancreas, something with the alpha or beta cells, something like that. But something's not working right with your cells in your pancreas, and you're not producing insulin. And insulin is the vehicle that takes all the sugar you eat and throws it in your muscles so you can use it as energy. If you don't have that, the glucose is just going to chill in your arteries, chill in your veins. And there's a lot of adverse effects from that. But essentially, you will die. Like you need
Did I say
you
liver?
need sugar. You did say liver, and your liver is also affected too.
Yeah, but
But
my brain, like this bio course, I'm like literally looking at my ears, guys. Oh God.
Leanne's
Anyway,
going through the ringer. She's going through the ringer.
this podcast is just for fun, guys. We're not doctors. Don't take this at
But
face value,
but we
okay?
are nurses. Leanne, don't forget, we're still nurses.
So funny. But yeah, you're right. Like, these people need these medications to live, and they're not covered. And
And like you need it. Like you're not
yeah,
born a type 1 diabetic, and like it's not like because
you
there's
are
this
born
huge
type 1.
yeah, but there's like this huge argument with type 2 diabetics being like, well, you just eat healthier, just eat healthier. And I'm not going to
Oh,
get into that,
yeah.
but with
Let's not
type
get into
1
that.
diabetics, they can't. Like there's nothing that they did to be in the predicament that their body isn't accepting insulin. It's like
Right.
or
It's like
isn't producing insulin?
it would be the same as like my thyroid disease. Like there's nothing that I did that they know of that
Yeah,
caused it. It's just fucking here. We're just living it.
you
So
drew the short straw. Sorry,
yeah,
Leanne, you just drew the
like
short straw.
yeah, of course. Like it just is what it is. And yeah, I mean, I can live without medication, but I'm miserable and like my metabolism it affects my metabolism, like all kinds of things, my eyes, my skin, my hair, my whole body. I feel awful.
Yeah.
Um but yeah, even my like Synthroid is not covered. It's just like it's absolutely ridiculous, like I don't know. I think I
and
pay like
and and
30
like
bucks a month, but it's not a lot. But the point is like
but right
I
there you're at a disadvantage for like no reason, and like
yeah.
call it this disadvantage or like not, but there's something that especially with like type 1 diabetics, and because insulin's not cheap.
Yo,
It's
yeah,
an
and
expensive fucking drug.
people will ration their insulin to make it last. So instead of taking 10 units, they'll take like 6 units and just decrease their dose to make it last longer. Like I've heard of people doing that. That is not safe. That's not it's just not acceptable the fact that people have to
Hmm.
do that. You know what I mean? That's like formula. Like we had a shortage in formula and it's just like what do you want moms to do that can't breastfeed?
Yeah.
Or like, oh, just supplement with like regular milk or homo milk or whatever.
Mm.
But, you know, maybe people don't have access to that. Like, there's a lot that goes behind
Milk is getting more expensive now too.
everything.
Like
Bro, eggs.
you have 4 kids. Oh, don't even talk about the eggs. I was supremely pissed when I saw the price of eggs. I was like, what the
Yeah, we're,
hell?
we're such millennials. Like, classic millennial statement. I can't
Yo,
believe the price of
I
eggs.
I straight up was looking up chickens online. I was like, I'm gonna just buy a fucking chicken and rooster. They can do it in my garage. I'm not
Yo,
doing this like
my friends have a
18 bucks for a
farm.
carton of eggs. Oh, your friends have
My
a farm.
Yeah, man, they have I don't know how many chickens, like 12 chickens or some shit. Like,
Yo,
yo, man, they gave us free eggs. Those eggs taste nothing like what you buy in the store. They're so good. The yolk
uh-huh.
is like perfectly yellow.
Like
Bro,
like a sun. It looks like a sun.
dude, farm fresh eggs, nothing is better. Nothing is better.
We need to get some chickens.
Yeah, man. Come back to
Leanne,
Alberta, buy a house, get some chickens, come live the
would
Alberta life.
would you have chickens in your backyard?
Fuck
Straight
no.
up. No?
Not in Airdrie. No.
Really?
No, man. Maybe if we lived
So
in the country, but like
uh,
you got to
I
take
I
care of
met
them.
someone. I met someone who lives in Calgary, and he was like, I have chickens. I'm like, oh, do you live like on an acreage? Like, do you live? He's like, no, I live in a suburban area. Like, pretty much those houses that like there's not even a foot in between the houses. And I'm
Yeah,
like,
yeah,
don't your neighbors get annoyed? And he's like, I just don't care. And I'm like, well,
yeah.
like that's a little rude to say, but I was like, this guy just
Okay.
straight up has like 12 chicken, like not like a few chickens, like he has a whole coop in his backyard.
Yeah.
And I just think like I don't know if I lived in the city, I don't know if I would do it because I do care about my neighbors. I wouldn't want to be that person with like a rooster cockle doodling like at 5 a.m. every morning.
Yeah.
Um
No, you
um
got to feed them. You got to let them out. You got to
yeah, and they just
feed
bug
the
everyone,
eggs, the
you know.
hay.
But I
Like
would
there's a
get some
lot.
chickens if I had like some space between my neighbors,
Listen, man, you do you.
you know?
Soon you're going to be
Well,
running your own practice, have chickens on the side. You'll be like half farmer, half nurse practitioner.
oh man, it's gonna be great. But this is what the Canadian government's doing to us, Leanne. They're screwing us.
Oh my gosh.
I have to be held accountable. Like I'm literally like this summer I want to like start growing veggies and stuff.
Oh, I did. I planted all my veggies.
Oh, really?
Yeah, I'm
Already?
getting them ready. Yeah.
You planted them in soil?
Yeah, inside.
Like inside. Oh, okay, okay. I
Yeah,
was like,
and I got
damn.
yeah, you like you sow them in early and get them growing and then um because Alberta's like been pretty warm, so we're anticipating like an earlier spring. So I started earlier this year. Normally I wait till March, but I'm kind of hoping that I can like sow in more veggies throughout the summer and maybe have like a double harvest. Yo, I'm stoked. I
Oh,
have like
nice.
3 big gardens in the back, like planter boxes that came with the house.
Yo, that's sick.
Did
That's
I not
actually
ever
really
send you a
awesome.
picture of them?
You sent me a picture of the house. I don't know if you sent me a picture of your backyard.
Oh.
I think
Maybe
I
I'll
think
do
I
that.
might have seen them when you sent me pictures of your cat.
A fucking cat that nobody asked for.
This is the thing too, just cats everywhere. That's actually
Ew.
another huge issue is that there's just cats everywhere, guys. Stray
Yeah.
cats just chilling about. And apparently down east, Leanne, I on my contracts I met you Nova Scotia and stuff because like there's no jobs out there, so they all go to Nunavut.
Yeah, of course.
But they have a huge stray cat problem. She was showing me pictures. This girl was like going for a walk. There was hundreds of cats,
Jesus.
hundreds, and I was like, no way. She's like, yeah, this is just like a normal day in Nova Scotia. There's like thousands of cats on the sidewalk.
See, like spay and neuter should be free too,
Yes,
I think. But
there's a
anyway,
lot of.
that's like
I
a whole
think
other topic.
in Saskatchewan, there's a program, and yeah, we could talk about that in another day. But there's a whole program
Maybe
for that.
maybe when we get our puppy, which hopefully we're praying is this weekend, we can do a little chatty episode on our animals.
Oh yes, I'd love to. Oh man, you're getting the puppy this weekend,
Maybe.
just in time for Family Day.
Yeah.
Aw, that's gonna be
I
adorable.
know. We'll just be one big happy family.
Do you know what his name's gonna be or her name? His name?
It's a boy. No, not yet. We kind of want to like feel out his personality, you know?
You should post a picture, guys. Leanne's gonna. I've already decided. Leanne's gonna post a picture on Instagram, and we're gonna have a
Not yet,
poll
not yet, not yet, but I will.
when you get the dog.
Yeah, yeah, I will. Because
And
I haven't even shared him like to my own socials yet.
okay.
But I will. Anyway, I think that
I
wraps
already
up
have
this
some really
episode.
great names. I'm gonna text you. I'm just thinking about names right now. I'm like, ooh, I got some bangers. I'll send them to you.
Send them my way. All right, guys. I guess that wraps up today's episode. Quick little chatty episode today. As always, don't forget to follow, share on Spotify, share this podcast with your friends. Hit us up on Instagram, Nurses with Attitude, and we'll see you next time.